from time to time, we talk to people that maybe have diabetes or, heart disease or whatever, and you kind of open the door and you say, this plant-based diet thing is very powerful. And you'll talk to them a little bit about it. And it's actually the minority of people that will really run with it. Most of them have some kind of an excuse. They don't want to try it. They're skeptical. You and I know it would help them. There's no question. It's frustrating to talk to these people and they come up with reasons why they don't want to do it. Do you have any tips on how to gently persuade people?
Well, my tip is that you can't persuade them in a short period of time in a medical visit. It's too short a period of time. Mm-hmm. They need a lot of education. And as a medical doctor, I think when I advise doctors who practice lifestyle medicine and nutritional practice that when people join their medical practice, they should insist they come to group visits. To be part of the practice, they have to attend group visits at least once or twice a month. And where the doctor is talking to the group for an hour and a half. And the patient pays the copay for the group visit. You bill out, it's legal, it's a legitimate billing expense for a group visit. So the doctor gets paid. And the chronicity of the education over and over again and reviewing the studies and the findings and the risk of death, then people will eventually make the change. But you can't import a 15-minute medical visit, make a few suggestions and expect people to change. Yeah. You give people a tremendous amount of information. And of course, obviously, I say to people, I'm speaking to a group of 500 to 1,000 medical doctors in an auditorium. And I'll say to them, raise your hand if you've been struck by a bullet or stabbed by a knife or anybody in your family has that happened to. And like one person will raise their hand. And I'll say, okay, raise your hand if you had a heart attack or a stroke or a cancer diagnosis in your family. And everybody's hand goes up. And I say, do you want to stay living in that dangerous neighborhood? Why would you still live and under the risk that everybody else has when you're seeing the prevalence of risk is so high? Then why wouldn't you do something to mitigate that risk? It's insane, and it shows the power of food addiction and that you are not in control of your life. Your food is controlling you. You've lost the keys to the bank, and you've lost the ability of your brain to make the right decisions on your own behalf. Why would a person put self-destructive substances in their mouth? They're the person controlling their health destiny. So we train people, and I'm saying with enough information and with the right type of motivational information and scientific information and training on mindfulness and how to be, and happiness training, how to be happy, then people can succeed and they do want to make the change. It takes a tremendous amount of point of contact with individuals to enable to change their fixed and addictive mindset to want to make that change. That's why people come into my retreat for like 2 or 3 months, and we make it so the time they leave here, they can go back in the real world and be happy and consistent with staying with the program and continuing the benefits where they on their own, they couldn't do it, or a week going away to a getaway, they can't do it either. It's not enough time for their brain to reset itself. So I'm not saying everybody has to come to my retreat. They can instead read books, watch videos, join member centers, join like my member center where we're supporting each other like you're doing. People could, listen to your podcast videos. They can get more information. They could work, but they have to work for that. They have to put effort into it. So first we have to convince them that this effort is worth it.
Yeah. I think it's about, for me, my attitude has changed. Like people say, I can't understand how you can be so disciplined avoiding the cheesecake or whatever that somebody brought to work. It's not even an issue of discipline anymore with me. I don't want to have heart disease. I don't want to be sick. I like the way I feel. And I have a connection between eating that food and undermining my health. So it's no longer even an issue of discipline. But
no, it's not a matter of discipline either, because we have desserts that taste just as good as that. I don't need their disease-causing dessert. I can have a healthy dessert.
Right. Yeah.
I made a healthy fig Newton. It was like made a fresh figs from my garden. We made banana ice cream made with fresh bananas and macadamia nuts and vanilla bean powder and a little splash of plant milk. It was like melted in your mouth, and without that heavy degree of sweetness and the chemical taste you get from regular ice cream. What I'm saying is, we make a Thai curry sauce. We're making food taste delicious. We're not giving up anything with discipline. We're just smart. It's just smart nutrition. And you enjoy the food more, not less, because now our intellectual self is comfortable with our emotional self. So we're getting pleasure and we're feeling good about ourselves, and we're intellectually satisfied, and we're feeling that we're healthy, and we're feeling better too. We're sleeping better. If I go eat on something unhealthy, I'm up half the night drinking water all night long and then running to the bathroom the whole night. I can't even sleep when I eat unhealthy. And my stomach's, I feel better. And like you said, you have energy. You gives you emotional and physical feeling of physical well-being too.
Yeah, for the food, the food can be delicious. Like today, I had a Kung Pao chickpea dish that was just absolutely, delicious.
Right.
I'm sure I had the best lunch of anybody at work. Now,
we're not giving up. We're not giving up enjoyment of eating. The whole thing is ridiculous. Is people think that, I couldn't do that, and I don't. I'd rather be dead if I had to eat carrot sticks and celery. It's just their food addiction talking. They don't know enough yet. Even the taste buds get stronger when your health gets better and you stop over stimulating the bliss point with so much sugar and salt and spice, and your taste buds improve so that what you're eating, you adapt to what you're eating. You like it better.
Absolutely. I find that, as the palate becomes more sophisticated, you can appreciate this broad range of tastes that you never even appreciated before.
Absolutely. That's so true.
Like one of my favorite things is, just raw veggies. Or I remember like early in my process, I remember coming home one day from work and I was really hungry, and there was just cold steamed broccoli sitting on the counter with nothing on it, and I ate it, and I couldn't believe how flavorful it was.
Oh, that's like a dessert that you can melt in your mouth, like steamed broccoli with roasted garlic and just a little touch of spray of olive oil. When it's cooked, it's like melts in your mouth and then my favorite foods is artichokes, like steamed artichoke hearts, just plain with nothing on it. Like, wow, it's like a delicacy of the gods. Much better than eating like escargot or caviar. Have a steamed artichoke heart. It's the greatest thing. People don't even know how good natural. And what about a fresh fig that you picked off your own tree that ripened on the tree, or growing some of your own food like tomatoes? And you know what a dry farm tomato is, where you don't water the plant in the last month before you pick it. As the tomatoes ripen, you purposely don't water to increase the sweetness of the tomato. But the point I'm making is there's so many incredibly delicious natural foods that are just delightful. Yeah. And it's even more emotionally satisfying when you grow some of it yourself, and you made yourself your own food.